doctor will be here with you in a minute, okay?
Thank you.
Hello, good morning. My name is Amber, and I'm going to be your nurse for today. And I'm here with a student. Her name is Leslie. Is that all right with you?
Yes, that's
Okay.
fine.
So we're going to perform a head-to-toe assessment. Is that okay?
Yeah.
Okay. So I'm going to go ahead and step out. We're going to wash our hands. Happy birthday to you. Okay, so it's good. So then we're going to come back in. And we are going to close the door for privacy for the patient. And then we are going to have you state your name.
Laura Soto,
Okay, may I please check your pad? Okay, and may you please state your birthday?
618.
6/18. Okay, perfect. You are the correct person. So now what we're going to do is we're going to ask you a couple of questions. Do you know why you are here?
To get a physical.
A physical done? And do you know where you are at?
Downey Clinic.
Downey Clinic? Okay, and do you know who our president is?
Trump.
Trump? Okay, so the reason I asked these questions is because I wanted to get familiar with your neurological status, which is, it's good. So now what I'm gonna do is I'm going to take your vital signs. So my student Leslie is gonna go ahead and take it for you so she can get a little bit more experience.
Okay, that's fine.
So you can go ahead and take it.
Okay, so we're gonna start off with the blood pressure and we'll locate the brachial pulse. Okay, so the brachial pulse is located here and I'll put my stethoscope on top of that area. Okay, so your blood pressure is normal, 117/72.
Thank you.
And next, I'm gonna check your radial pulse for 1 minute. Okay, after 1 minute, your pulse is 70 pulse beats per minute. And your O2 sound.
So
Okay, so the O2 sat is at 97%, which is normal. And your respirations for 1 minute. Okay, they are normal, 14 respirations a minute. Are you in any pain?
No.
Okay. And your temperature, have you had any hot or cold food, beverages?
No.
Okay. So I'm gonna place this under your tongue. Okay, so after 1 minute, the temperature is 97, which is normal.
okay. So we have finished with the vital signs, and you said you didn't have any pain, correct?
No.
No pain? Okay, perfect. So now let's get started. I'm going to check your head. And the way I do it is I'm going to place some gloves on. So now what I'm gonna do is I'm gonna check your head, making sure that it is symmetrical to your shoulders, which they are. And now I'm going to briefly look through your hair to see your scalp and make sure that there's no lesions, any dryness there, irritation that could be dandruff also causing itchiness, any infestations of lice, which everything looks good. Your hair looks healthy, shiny, and not dry. After that, check your eyes, and I'm gonna come in from the side. What I'm gonna do is flash the light so I can see how much your pupils constrict. Okay. So just look at me. Okay, so they constricted to about a 3. This is what I would use to put in my assessment. Now what I'm gonna do is I'm going to check your ears. Since you are an adult or a person over 3 years old, I'm gonna use the up and back method to look inside for any cerumen occlusion or impaction. And I'm gonna do that again to the other side, so there is no visible drainage. The next thing I'm gonna do is I'm going to have you lift your head up a little bit so I can look into your nares and look for any drainage or any occlusion with any foreign objects. Now I'm gonna have you open your mouth and take my tongue blade. And look inside. So everything looks very normal. The oral mucosa looks pink and moist, how it should. I'm gonna go ahead and do this. So now I'm gonna take a look at your neck with your shoulders, and it is also symmetrical. I'm gonna look at your carotid pulses, and they are there, strong 2+, and look for any jugular distension, which obviously you don't. So now I'm gonna go ahead and look, auscultate her lung sounds.
Okay.
So
What kind of sounds are we gonna be listening for?
So they should be clear. Things to look out for as abnormalities would be like stridor. That would be, you know, something obstructing the throat. We would be looking for any wheezing, bronchi crackles, and that would all be abnormal. So we're hoping for some clear lung sounds.
Okay.
So we're gonna start off here. Please take deep breaths. Go ahead. Go ahead. Go ahead. Go ahead. Go ahead. Go ahead. Okay, now we're gonna take a look at them in the back. So now we're gonna go ahead and take a look at your heart valves. We're gonna start off with the pulmonic. Now the aortic. Now the tricuspid. And now the mitral. Okay, everything sounds good. Now I'm gonna go ahead and have you lay down so I can take a look at your apical pulse and then your bowel sounds.
So how do we locate the apical pulse?
That's a very good question, Leslie. So in order to locate the apical pulse, we are gonna go to mid-clavicular, which is right here, and we're gonna go 5 intercostals down by counting the rib spaces. 2, 3, 4, 5. So it should be right here. So once we have located, we're gonna go ahead and take a listen for it. Okay, perfect. Now what we're gonna do is we're gonna go ahead and listen to the bowel sounds. There are 4 quadrants, and I'm gonna start listening this way and going counterclockwise. So we have to listen for one full minute. In case that we don't hear anything, we do have to listen to each quadrant for 5 minutes, so there's no movement.
What sound are we listening?
So we are listening for hyperactivity and hypoactivity of the peristalsis. So here in the bowel sounds. Okay. Okay. So her bowel sounds are within normal limits. So now since we have auscultated your bowel sounds, we are gonna go ahead and palpate your abdomen. Do you have any pain?
No.
No? Okay. That's good. Now we're gonna go ahead and percuss. Okay, everything sounds good there. Now we're gonna go ahead and look at your genitalia area, and we're gonna look under your gown. So I'm gonna lift it up, and we're gonna have you open your legs. So first I'm gonna feel for your femoral pulse. Okay, they are both good. Now I'm gonna go ahead and put on my gloves.
So what are we looking for in the genitalia area?
Okay, so we're gonna make sure that there's no discharge, because that can be an indicator of yeast infection. We're gonna look at any manifestations of maybe lice, of body lice. We're gonna take a look and see if there's any sores in there, indicators of gonorrhea. But everything looks fine. So now that we're done with the genitalia, I had washed my hands and I removed those gloves and I put a new pair of gloves on. So now, since her gown is still open, I'm gonna look at her legs, make sure there's no lesions, any edema, any pallor, any coolness to the area, and then we're gonna check her pedal pulses.
What's a pedal pulse?
So a pedal pulse is the pulse that is located here between the great toe and the toe right next to it, and you just go down it right there. So the way that you just locate it like that, and then you just make sure that you can feel the pulses right there.
Why?
So the reason that we check the pedal pulses is to make sure that there is venous return and circulation to the lower extremities. So now that we are done with this area, I have washed my hands and put on a new pair of gloves on. We're gonna go ahead and have you turn to that side, putting one leg over the other so we don't get hurt. And we're gonna take a look at her back, her elbows, and all of these sides right here because they are bony prominences, and that can be exposure to pressure ulcers. And we just want to make sure that there's no redness because that could be a very good indicator of that.
Okay.
But so then we also want to make sure if this patient is incontinent. If they're incontinent, most likely they're using briefs. If they're using briefs, we have to look at this area and make sure that there's no skin breakdown occurring. So everything looks good here in this area. So now we're going to go ahead and test for her musculoskeletal system. We're going to make sure that she has movement in her upper and lower extremities. Can you please move your right leg? Okay, go ahead and put it down. Can you please move your left leg? Alrighty, go ahead and put it down. Now can you move your right leg up? Can you bring your right hand up? Okay, bring it down, and your left arm. Now can you please hold my hands to see the equalness of your strength? Perfect, she has equal strength. So this concludes our head to toe assessment. Thank you so much for letting us assess you, and I hope that you got the experience that you need to do as is. Okay, thank you.
Thank you.